Hi everyone, Dr. Ashley here. Today I want to talk to you about IBS. I want to give you the inside facts about IBS and what is likely making you feel the way you're feeling. Whether that's a sense of urgency or you're unable to go to the washroom every day, so you might be more on the constipated side, or you are having looser stools. So let's talk a little bit more about IBS. So first off, I want to mention that 80 to 90% of cases that I see in my practice and that I treat are actually due to a small intestinal bacterial overgrowth issue. So there are many things that can predispose you to getting this issue. So basically what happens is bacteria from our large intestine make their way backwards and colonize in the small intestine. And you can believe it that they are quite happy here because this is where we absorb our food. So they can ferment off of foods that we eat, and they give off gas and cause bloating and cramping as a byproduct, along with frequency to go to the washroom or an infrequency to go to the washroom. So what predisposes us to getting the small intestinal bacterial overgrowth? So there are a few factors. One is a history of frequent colds and flus. So if your symptoms have been worse since you've been sick, maybe you were vomiting, you had diarrhea, really bad cold, and your bowels just haven't been the same since then, that could be the reason why you have IBS. The second reason would be a history of food poisoning. So bacteria that we ingest can release toxins in our system, and these toxins disrupt that migrating motor complex that is responsible for regular peristaltic motions in the body so that things get swept down the intestinal tract the way they should be and excreted as stool. The next reason could be, again, it involves infection, getting sick overseas when traveling on vacation. So you could be exposed to different bugs that you aren't usually exposed to, and this can also disrupt that migrating motor complex, causing those bacteria to retrograde and go backwards into the small intestine. Another reason why you might have small intestinal bacterial overgrowth is due to medications. So some medications can actually slow down transit time in the system, and this allows bacteria from the large intestine to make their way backwards up into the small intestine as well. Some surgical procedures are not done hygienically, we'll say. So if this is the case, if you've had like surgeries, near the abdomen or anywhere in the body, for example, bacteria can be introduced into the system and again, disrupting that migrating motor complex. If you have been suffering from IBS, let's say you have had your testing done, you've been told this is what you have, there's not too much you can do about it, change your diet, which can help for sure, but we do want to treat that bacterial overgrowth cause, which is, like I said, very common in IBS. So if you're looking for a new approach to treatment, I recommend reach out to me. I'd be happy to chat. Let's set up a 15-minute free phone consult or discovery call, whatever you'd like to call it, and let's see if this is something that might be beneficial for you. Feel free to reach out. I'd be happy to help you guys. I want to help you feel better. I want you to get back to your normal routine and quality of life, enjoy time with your family, friends, and get your work done as easily as possible.